This is Dr. Adams, and I wanted to talk briefly about ways to control double vision. I've talked about this at length in some of my double vision videos. However, there's really basically only a few things we can do. There's observation, which is a nice way of saying doing nothing, which most people don't want to do. There is occlusion, which basically blocks the vision in one eye. People wear a patch, or I'm going to talk about some other modalities, but certainly patches are one of the traditional ways of doing it. There are prisms. Prisms are basically an optical way of moving the world into a different place. They can be ground into a pair of glasses and may limit double vision. There are temporary prisms called Fresnel prisms, like this, which are a piece of plastic that we can, cut around, and this one has actually been cut for a lens and then applied to a pair of glasses in order to act as a prism. And then there's eye muscle surgery as well. Now, frequently, patients will have a form of double vision that isn't constant, it's changing. These would be people that have a mini stroke to one of their nerves, like the sixth nerve, the third nerve, or the fourth nerve. These are people with Graves' disease, where the inflammatory process takes time. And unfortunately, in those patients, you're looking at a moving target for the double vision. So an expensive ground-in prism is only going to last for a few weeks before their vision changes. Or a Fresnel prism may actually sometimes even train their eye into a new eye position if their condition gets better, such as in a mini stroke to the fourth nerve, the sixth nerve, the third nerve. So for those patients, for those Graves patients who are changing, or for people with microvascular strokes to one of the nerves that control the eye, what I have taken to doing most frequently is a little bit of tape occlusion. And what I do is I take a penny as my guide, and I take a piece of Scotch tape, and I apply the Scotch tape to the penny, like that. And then I take my penknife, and I'll either use the blade or frequently the scissors on the penknife to carefully cut around the penny. To get a small round piece of tape. Which can then be peeled off of the penny. And that can be applied to the patient's glasses right in front of their eye. We just kind of would line it up with the patient and put it right in front of one of the eyes. And that little piece of tape blocks the central vision and really suppresses the double vision in those patients very effectively. And that works quite nicely for people who have a form of double vision that may be evolving or changing over time. So I just wanted to give that as a little tidbit as to one of the ways that I personally treat double vision in patients. Have a wonderful day. Thanks. Bye.